Meeting to order at 10:03. And Kelly Hickey, since you're all dressed up in red, white, and blue, would you please start us with the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Can I please get a roll call, Perla? Oh, yes, I can do that too. Sorry.
Freeman,
Present.
Berkowitz,
Here.
Costa,
Here.
Dean Schlattman, Hickey,
Here.
Mitchell,
Thank you.
Butler. We have a quorum.
Next up, I have the approval of minutes from our regular meeting, June 5th at 10 a.m. Can I get a motion, please?
So move, Mitchell.
Second.
Freeman,
Yes.
Berkowitz,
Yes.
Costa, Hickey,
Yes.
Mitchell.
Yes.
Motion passes.
Thank you. I do not have any old business. I do not have any new business. This is going to be a fast day. Informational reports. Pardon, knock off one. Informational reports. We have Maggie McDowell with Sunny Hill Nursing Home. Did anyone have any questions for Maggie? Nope. Maggie, do you have anything special you want to share with us? Okay. Julie, did you have any questions? I just did.
You did.
I did.
You did that.
I mean, we, as county board members, it's our job to look at the reports and if,
Just because we have an hour doesn't mean we have to take.
right, I mean, if Maggie feels that there's something special that she needs to bring forward or point out, I mean, I've read them and it's impressive as always. So, thank you, Maggie. Next up is the monthly update with Elizabeth Bellata with the Will County Health Department, and she's up here. Do you have something special to tell us? Okay, and no, I'll be asking you guys if you have questions. Go ahead. Oh, I got to turn it on again.
Oh, excellent. Good morning, everyone. Elizabeth, Will County Health Department. I'm sure, as you said, you all read through my report. I just wanted to do a quick couple items out of the report and highlight them. First of all, under impending reductions in revenue, we did have one of our grants, the Well Woman Grant, terminated. So we did have impact bargaining on June 26th, and that did impact one community health educator. We also were notified that our Better Birth Outcomes Comprehensive Grant is being reduced by $51,630. And we were also notified that our Emergency Preparedness Grant will have a 27.52 reduction. However, we don't know the amount because they haven't told us what our grant is going to be. And that started on July 1st. So I guess we'll just continue on waiting to hear from them. Our respiratory surveillance outbreak grant is still under injunction. That is the grant that goes until July of 26. So we are continuing to operate through the injunction. We still have not received any formal notification for our city's readiness or our HIV prevention grant. So we're still awaiting those. And those also began on July 1st. They told us to hold tight. So we are holding tight to hear from them. And then, of course, there's most likely going to be some changes with Medicaid and Medicare that we will have to impact. And I put in the report the patients, the percentage of patients in our agency that rely on those types of healthcare. In the community health center, we are continuing to do updates. As you know, our community health center is over 20 years old and does need a facelift here and there. So we are working on floors, parking lots, counters, different things like that. Yeah, facelift. So you can see that our health equity team that's further down is constantly in the community, going to various events, telling different people about what the health department does, all of our programs. And so they continue. And next month, I will have even a larger list as the summer kicks off with even more events. Safety, we continue to provide drills and training for our own staff. And then under WIC, I just wanted to point out that we did open our second milk depot at our North Branch office in Bolingbrook. And we collaborate with Mother's Milk Bank of the Western Great Lakes. We had a grand opening on June 13th and it was very well attended. So we had our first donor on that day and she brought 1,000 ounces to donate, which is 10 gallons. And the milk bank was, everyone was completely impressed. So that was the great first donor and we gave her a certificate, took her picture and celebrated her and her baby. Let's see, the I-Plan map, mobilizing for action through planning and partnership. So we put together our I-Plan, which is our Illinois needs assessment for Will County. We took it to our board in June and our Board of Health did approve it. So the end of June, July, beginning of August, we will then submit it to Illinois Department of Public Health. It is a requirement for us to be a certified local health department. So we will get it in. We're getting it in early. Hopefully they have no issues with it and they approve it and it's a 5-year approval. So we're hoping on that. One other thing under immunizations, we are partnering with local school districts to provide immunization clinics so that students are not withheld from classes when they start again in August. So we have a lot of partnerships with them. Other than that, I just wanted to go back to the funding issue. So we have had numerous conversations with our board and our board is extremely concerned about our critical health department programming and the impact of the various cuts on our grants and the changes in our grants and with Medicaid. So we are actually working with our Board of Health to determine the best strategy to retain these critical programs that no others in the areas provide, the health department provides them, and that may include a request for additional levy funding for our FY26 budget. So I just wanted to put it out there. We will be working on more information and we will bring it to you then next month. For the health department for critical programs. So we are losing staff in immunizations, in communicable disease, and emergency preparedness, and better birth outcomes, and maternal health and child. So there's a lot of our divisions that because of the grants and the lowering of grants that we are losing staff. So we are going to be asking, we're going to do a critical review of all of our programs to make sure other entities in the community don't provide them. And if they don't, then we have to continue to provide those programs, including HIV, STI, and things like that.
So I know that the health department runs largely on grants. And with all the grants being cut, it is going to have a trickle down effect. I've been very concerned about that. I know the first thing that was cut was the women's health.
Well, women grant.
Well, women. And I'm aware that positions are being gone.
Correct.
Because cuts have to be made. Can you just list off some of the critical services that you're referring to?
Of course. And as I stated, so the ones that we are looking at that will be impacted are immunizations, HIV, STI, maternal health, our better birth outcomes, as I stated, emergency preparedness is losing some funds. But communicable disease is a big one too with all of our communicable disease investigators. And there's also a concern regarding behavioral health, of course, but substance use, tobacco. I mean, we just don't know because a lot of our grants are all on different cycles. So some of our grants ended now, June 30th. And I told you about the city's readiness and the HIV prevention grant, which we have not heard from. Some of our grants end on August 30th. Some of them end on November 30th, and some of them end on December 31st. So as these dates approach, we wait to hear from the grantor if we're going to get the grant, how much are we going to get? Family planning is another one. I forgot about that. Sorry, our community health center implements family planning. Family planning is supposed to be getting a 55% cut from the down to the state. So we are thinking that they will then cut our grant amount by the same amount.
Would make sense.
So-
We do have some lights on. Julie Berkowitz, you were first, so go ahead.
Thank you, Micah. Okay, so Elizabeth, with the Well Woman Grant, how many women receive care from this grant?
You know what, I'm going to see if Cheryl from Family Health Services might to address that. And it's not a, we actually do promotions of women getting their wellness checks. So that grant is to
So you
encourage
use it for
women.
media? You
to,
use
yes,
some-
to encourage people to go to their
Okay.
own care doctor, our doctors, anywhere to get their mammograms and all of their checkups.
So can you give us a breakdown of where this grant is spent? Can you provide that to the committee?
Of course I could.
Okay.
We can
because-
submit our budget that we used up until June 30th. Yes.
Sure, specifically, where is that grant spent? I would like to know, like, are we spending $250,000 on media?
It was a $125,000 grant, so that's it. And we did have one community health educator that was their main purpose of going out to
So
community
if you
events.
could provide that
Of course.
to Chuck, and then he can provide that to the committee and to all the board members. I just want to know how these grants are spent. You mentioned 1,000 gallons of breast milk were donated.
Ounces.
Or ounces. Sorry, I wrote
Gallons are modulated.
I wrote OCS, but I said gallons, pardon me. Well, that is a huge quantity from
One donor.
one donor. So how long does breast milk stay fresh?
So we work with Mother's Milk Bank, and you can add to this. So what we do is we're just the drop off. So you have to get approved through Mother's Milk Bank of Western Great Lakes. They have you do some blood work and some other things. Once
Yeah.
you're approved, then you can donate your breast milk to us, and we're just the donation point. Mother's Milk Bank of Greater Western Great Lakes then comes and picks it up, pasteurizes it, and then gets it out to hospitals, NICU units, and mothers that maybe, could not supply enough for their babies. I don't know how long it is good after pasteurization. Do you have any idea?
No,
Here.
and there
This
is.
is Cheryl. Introduce yourself.
Hi, Cheryl.
Hi, Cheryl. Hi,
Cheryl
I'm the,
Picard.
I'm
Hi.
the assistant.
So hold on,
director
can you
of Family
click
Health
on number
Services.
9, and that'll be easier.
Wait till
Okay.
it's spread. Say your name again.
There you go.
Okay, all right, Cheryl Picard, and I'm the Assistant Division Director of Family Health Services. So there are time constraints as far as with the donation, part of it. So I believe, I'm trying to even think what it was now. It's a relatively, large, span of time though that they can donate. So it is though, it's very much controlled as far as with, again, like Elizabeth said, they have questionnaires they have to, answer. There's blood work that has to be done. They have to be an approved donor in order to be able to provide then that milk to the milk bank. And then, and then after that, then they take care of it. We have a freezer that actually was supplied by the milk bank, and that's what then we put the donations in and let them know, and then they come and they pick it up generally on that same day.
So I have gone through a little bit of this. And I did just look it up. Room temperature breast milk can last up to 4 hours, refrigerated up to 4 days, and in the freezer 6 to 12 months, as
Right.
long as the temperature is adequate
Right.
freezing. You don't want one of those freezers that thaws and
Right.
freezes
Correct.
again.
Yeah.
Yeah,
Oh, I'm
I-
sorry. I was thinking you meant how long they were, able to do the donation. So, yeah,
Well,
but that's correct.
yeah, the whole thing is very fascinating, but I just wanted more information because we're accepting, so we're not doing any of that criteria. We're just accepting the milk. And then I would assume they make sure there's no drugs in the milk as well and you mentioned pasteurization, which I find fascinating, so I'll have to check that out.
It's called Mother's Milk Bank of Western Great Lakes. So they
Yeah.
are, I think they're
Yeah.
pasteurization places in Elgin or
Hmm.
Elk Grove Village or something like that. But
Okay.
Yeah.
I think it's a great program. So I also have a question regarding the immunization clinic and our relationship at the school. So do we get permission, signed permission from the parents before any vaccination is just administered?
Yes, the parent has to actually sign a consent. They need to be there because they are minors. So we're not doing it like during school hours. It's after school hours. Parent has to be there with the child. They sign a consent, receive the vaccine information sheets, and then that's how it's done.
we also did it at a kindergarten roundup, so the
Mhm.
parents were there. So
Right.
we tried to coordinate with the school when they're having parents and kids come to the school.
Okay, and then when you were talking about the grant, you mentioned that we have services that aren't provided anywhere else. So what are those services that you can only get at the health department?
So those are the things, well, HIV, STI with our our ID doctor. So that is one of them that we do provide to numerous patients all over, and they come to us for that. Better birth outcomes, some of the programs that we operate. So which is case management of people that are to encourage that they have a better outcome with their birth. We have some of the other programs that
Actually, one of the big
Family Health
things.
Services implements.
Right, and one of the big things is immunization. So the vaccine for children, the VFC program. So anyone can be a part of it. However, the majority of the independent providers throughout the county don't do it anymore because there's such strict guidelines that they have to follow, and it has just become so cumbersome for them that they just aren't able to do it. So
Who is they? The
pediatricians,
people?
the pediatric providers. So the VFC, so that's the vaccines for children. So those are for the uninsured or underinsured children. And so that program then allows us then to give those vaccines.
So
to
you're
kids.
saying medical providers can't keep up with it?
Yeah, they don't want to continue that program because the restrictions are just so tight. It just makes it very difficult. for
So,
them.
I mean, many of us here have had children.
Right.
It's pretty simple what vaccines your children need to have.
Mm-hmm.
Why is this such a problem?
There's
I mean-
there's inventories that need to be done, twice a day. They have to have, refrigerators and be, checking those. There's a lot of, because it's a governmental program then too, they're very strict as far as with both the, supplying of the vaccines and then,
Okay, so hold
how they're
on.
being. Mhm.
You mentioned governmental program.
Right,
It's for the underinsured or uninsured.
uninsured.
So they probably don't
Okay,
have a
so
pediatrician.
you are not talking about the general public.
No.
You're talking about, this is a program, a government program, and it's only for people who don't buy insurance,
Who do not have
right?
insurance.
They don't
Underinsured.
pay insurance. They don't have insurance. Okay. And you're saying that private medical won't deal with this?
Correct.
Correct.
They don't take any pay, and this
It
is
might be with some.
everybody?
We don't know how many, but there's a lot of, in Will County, there are numerous pediatricians and doctors that don't want to
Okay.
implement this program because of all
Okay.
the restrictions.
Well, I would like to see the numbers. I'd like to see the numbers from the health department.
Of what?
How big is this program? How big is the VFC? How many how many uninsured people do you provide services for?
Here we go.
I'd like that in written and submitted to the committee.
Hit your button, please.
Okay.
I saw you coming.
evening.
Introduce yourself,
sorry.
please.
Denise Bergen, I'm the Assistant Executive Director at the Health
Hi, Denise.
Department.
Yeah.
So we have two components to this program. There's the VFC for uninsured, underinsured children. A lot of people have insurance, but their insurance doesn't cover vaccinations. The other population is our adults. It's a 317 adult program, immunizations provided by the state, federal government to cover adults who are uninsured, underinsured. And like Cheryl said, these are very cumbersome programs. And it has to do with the volume. So the providers, the pediatricians' offices, they don't provide the volume of these vaccines to make it worth their time to participate in the program. It's not cost effective for them. And so that's why they elect not to provide the vaccines. They send those children to the health department for services.
Okay, so if you would then provide us with the
Certainly.
data.
I think they have in the
Absolutely.
past, so that would be an easy
Right.
one to just send
And
us
we have
again.
looked at it about,
We have?
I'm pretty sure we've received.
as
a
an agency, we've
breakdown.
looked at
Okay,
it. I'm
when?
not sure we've provided it to public health and safety. In total,
I've seen it. so-
I know you've seen it. But you're on our
Share
board.
with me,
Micah,
Micah.
so you've seen a lot.
I get it all confused.
I know
Sorry.
it's total. We do keep very close track of the services we provide. And over 50% of the vaccinations are provided to the Medicaid, Medicare population. So again, that is the primary population we serve. The thing with the VFC vaccines, they are provided free of charge to us. We are allowed to charge an administrative fee either to Medicaid or to the patients directly. And that administrative fee is capped by the federal government as to what we can charge.
Okay, so for the Medicare and Medicaid vaccines, those are provided free of charge.
Not Medicare. Medicare population is a bit different. These vaccines, the VFC and the 317 uninsured, underinsured, it also includes your Medicaid population. So the vaccinations we provide to the Medicaid population, we receive free of charge. And we are allowed to charge an administrative fee for those vaccines.
Okay, and do we ever have population patients show up that have not even Medicaid, they just don't have any?
Absolutely.
How
Right.
great is that population?
Or
So
can you get us
with
those
respect to
numbers?
that, I would have to look
Yeah.
at that and get that
Okay.
information for
Yeah,
you.
And
Yeah.
I know,
Again.
Elizabeth, you've said that is rising. And I don't know if it's that particular part of the population is rising in the demand for services at the health department. I
And we
think-
can certainly pull those stats for you.
look
We'll
at
look,
that.
you know,
Yeah, if you could
historically
get
when
us
it's
that
been.
report, that would be
Absolutely.
And the reason-
Absolutely.
Yes, the
Okay.
reason why I'm asking these questions is because we have our budget coming up.
Absolutely.
Elizabeth, you have already said you're going to ask for more levy.
Correct.
You sat down, that was one of the first things you said. And as a board member, and I represent my constituents who are struggling to pay their property taxes, I want to see the data,
Of
the
course.
numbers. I want to see how many people we can't say what their status is, but how many people have no documentation are we providing service to? Because we have taxpayers that can't afford to pay anymore. And this is all taxpayer dollar. And we're putting that population at risk. I mean, I know seniors who have worked their whole life, they're on Social Security, and they're not getting the care they need.
So the
So-
health department provides safety net services. So as I stated, we are going to look at our programs to see if other entities in the community provide those. If they don't, then we are the safety net for those programs. So whether Medicaid or Medicare gets cut and some people are no longer provided for, we still have to see those patients. We can't turn them away if they're under programs that we are the safety net for.
So I just want to make sure that with next month, we have this data. Okay, I want to see the numbers.
Even
I
if
know
you could
you're,
get it to us
I know the
before,
health
send it to
department
Chuck and he
is
can get it
getting
to
a lot
us.
of money from the mental health fund. And at some point in time, we have to figure out if we're duplicating services, somehow we have to figure out, these levies are killing our neighbors. I mean, and you know what, if you don't pay your property taxes, guess what? They take your house from you. And I know people, friends and family members where they've lost their home. So, it just concerns me.
Of course.
And I would like this information going
I
forward.
think that your
Okay,
request is more
thank
than
you.
fair. And like I said, if you get it before next month, if you send it to Chuck, he can send it out to us. Maybe it's a good thing just to send out to the full board, maybe at this point.
Yeah,
But,
we will get some information to.
Yeah,
Chuck,
we
of
love
course.
information, you know that. Okay, let me see who is next on here. It would be next in line was member Kelly Hickey.
Thank you. Okay, can I just summarize just a little bit with the VFC? Because vaccines that are distributed through pediatrician's office have a threshold of requirements they have to meet. The VFC has even higher Is that correct? And that's why it's not necessarily cost effective for.
Correct. And it's not just maintaining the vaccine, because you're going to maintain vaccine the same way, regardless of
Yes.
whether you buy it or whether it's given to you under this VFC program. It is the government required documentation. It is the eligibility documentation you have to maintain. It is a really detailed and involved program.
And it
And-
also is your caseload. If that pediatrician has
Sure.
one patient that happens to fall into that category, it's not worth them having all that program in place for that one person where they can send them to the health department so we can take care of it.
Well, if there's anything I've seen, it's that you guys are really good at taking care of that and keeping all of those reports. So thank you for doing that. Real quick, the communicable disease investigators, I know that early on, some money was moved around. Did you get 2 new people? Is that?
Through the respiratory grant,
Uh-huh.
that included 2 communicable disease investigators. That grant will expire in 26. That is the grant that is also under the injunction right now. So we are continuing the grant right now.
Okay, great. And are both of those positions filled right now?
I
Yes.
believe so.
Yes, they are.
Okay, all right. Thank you. I was curious about that. And then with the emergency preparedness, the readiness grants that you've gotten, are those under BRIC? Is that where they came from? The Building Resilient Infrastructure and Communities?
I do not believe so. They are a pass-through that comes through IDPH, so I
Okay.
do not know.
And I believe they originate with the CDC, if I'm
I'm pretty sure.
I-
it
Okay,
comes
all right,
from
Yes.
great. That's good to know because
Emergency preparedness.
I had some
Right.
information from the FEMA folks that had the BRIC grants, but
Yeah,
I don't know anything about CDC. So,
Right.
okay,
And
thank
they
you.
are all direct federal they are all federal pass-through funds.
Thank you very much. I appreciate it.
Okay, next is member Costa.
And thank you for all of your concern and the work that you're doing to be proactive and planning ahead with the impending grant cuts potentially to these programs, as well as, the possible elimination of Medicaid funding to the health department. In reading your report, Medicaid and Medicare revenue for the last fiscal year was $7 million. I know that you're saying the levy might need to go up in order for us to continue programming. If Medicaid, Medicare revenue is eliminated, and I just kind of I want for this committee to understand what that impact could look like. Are we looking at a $7 million shortfall?
if it was completely eliminated,
So the Medicaid changes
Yeah.
that are going to be forthcoming, their plan is over 10 years. I can't estimate for you what it's going to look like.
Okay.
As a federally qualified health center, as a community mental health center, and even for immunizations, we provide services, excluding immunizations, we provide services on a sliding fee scale. So what we do is we look at the patient's size or their family size. We look at their income, their federal poverty level, we gauge where they are at, and then we charge them accordingly based on where they fall within our sliding fee scale. We never deny people services based on their ability to pay. That's one of the tenets of what we are, of who funds us. Certainly, if you're shifting away from $200 Medicaid encounter rate to $35 patient payment, it's going to be a big change. Right now, the only Medicaid funding affected in the state of Illinois is the immigrant population, adult population. Children would still be covered, and seniors, there is some coverage for them. I don't know what that number is. That, again, as an FQHC, that is not documentation that we have been able to gather. So I can't even really estimate.
It's hard to fathom and to really, we don't have a crystal ball in
Right.
front of us. But what we do know is that 60% of the health department's revenue does come from Medicaid and Medicare dollars. And there will be a pretty tragic impact to the community, especially when we see that 85% of patients that utilizes our behavioral health services, pays through Medicaid. And that might be a portion. That might be $35. I mean, I think even if the health department was able to increase that sliding scale fee to $50, that's not going to make a dent to what the actual services and programming costs to us. So I think that this is something that we as a committee need to continue to pay close attention to. Thank you, Elizabeth, for continuing to bring information over to us and the updates that you're giving from the health board. But we need to be looking at this very closely to cover the gap, because I understand, you know, homeowners and taxpayers, they're struggling, but access to healthcare is a basic need. It's a basic necessity that we owe to every human being that we can service. I guess my question is, with the changes in adult immigrants and Medicaid, if an adult immigrant were to come into the health department and request services, we're not denying services, correct?
Correct.
So we're still expending services and work, but we're not getting reimbursed for that. I think that is also an important factor for us to understand as a committee. Thank you.
Well, we could be getting reimbursed from that patient directly.
Yeah, the small
sliding.
amount, the sliding fee
Correct.
scale. And we do review our sliding fee scales, our ordinances and the fees in all of our ordinance on a regular basis to make sure that they are, updated and in accordance with how much it is costing our staff to do and in line with the poverty levels that are required. So we do that on a regular basis. So that is maintained.
So I just have to say, as an educator, when I worked at one of the lowest paying school districts in the state of Illinois, with 2 young children, I was a recipient of some of those sliding scale services, and they're necessary. We had insurance. It wasn't very good, but we had insurance. And you have children, you need to get them immunized. I was a female. I needed my well woman checkups, and I would rather go there because I could afford it. So I appreciate that. That was a memory you sparked. So thank you so much for that.
And then thank you for putting up on the screen. We are having a health fair on July 12th. So if you are interested in attending, it is at our community health center from 10 to 2 p.m.
Cool. Thank you. And I'm sorry I missed the Mother's Milk Bank. I just couldn't make it.
I do have a question.
Oh, I'm sorry, Raquel. I didn't see your light on.
I know I'm quiet.
You are quiet over there. Next is Raquel Mitchell with a question for us.
I just want to know, we always talk about the federal government and local county tax, whatever. What responsibility is the state taking as far as our health department? What skin do they have in the game?
We wish they had more.
Yes.
Oh, there we go.
Yeah.
We have a regional health officer who we talk to on a regular basis, who is our connection to the director of IDPH. We are part of NIPIC, which is Northern Illinois Public Health Consortium. And so we have a legislative group, a board, everything, and we meet every week for the legislative and every 2 months for the board. And this is what we talk about. We talk about our grants, how our health departments are doing, and then we funnel it up to Illinois Department of Public
But what
Health.
is the state giving us?
Exactly.
Yeah.
So we haven't gotten as much support as we would like. For example, with the local health protection grant, we came to you telling you about the House bill and the Senate bill to try to reinstate a $5 million that came out of the local health protection grant 2 years ago. And we really wanted Illinois Department of Public Health to really support that, because that's the money they use to give to local health departments. It does not cover food, water, sewage, and communicable disease at all, but that's what it's intended for. We got not a really good level of support. They have a lot of pressure, obviously, from the state budget and the budget that way. They had us actually do a cost analysis of all of our programs at the health department for every health department in the entire state. It was called Workforce Development and Transformation. And so we worked with Illinois Department of Public Health. They wanted to see how much it costs us to actually implement our programs and what could they help, going through the state government to get additional funds. And unfortunately, when it came down to it, it was a heck of a lot of money across the entire state. And unfortunately, the program was sort of stopped. We have resumed the program and now we have a different twist on it. So we're looking at just how else can we address the shortfalls. they only have what they have. For example, with the family planning, if their grant is cut by 55%, they don't have any more to give us. They can't backfill the missing dollars. So I guess, long story short, I don't think we have great support. However, when we have questions and things like that, they do support us
Okay,
very
like,
well.
you've opened the door to like questions, and I'm sorry, I'm very curious because we talk a lot about, you know, with our county health department, we talk a lot about the federal grants or whatever. And, you know, we live in Illinois and we know the problems, the budgetary problems that Illinois has. And these budgetary problems started with the premise of we want to help the people. And if the least of us aren't getting health care, very basic necessity, that the state promised that they're going to take our tax dollars to do, then I want to know, what are they doing with our county health department? What are they doing with all the counties? What does Illinois Department, and this is not like rhetorical, I'm really curious. What is Illinois Department of Public Health? What do they do? Because I know I lived in Cook County. Everybody goes to Cook County Hospital when you're in Cook County and anything related to, or Stroger. I'm old. I just showed my age, you guys. And I know for our Will County, they go to, you know, the health department. So what is Illinois
Well, we
department?
report up to them. So all of the
Okay.
grants that come through them, they ensure that we are implementing the grants in accordance. They take on some things that we can't do, like manufacturing facilities, inspections. We do the retail food, they do the wholesale food. They do like the engineering design of swimming pools, and they do a lot of the immunization research, and they work with ACIP when vaccines are coming out. I mean, they have their own agenda. But on the note, I wanted to mention this. When we did that whole cost analysis across the entire state per health department, when the report came out, it did indicate that Illinois, out of 50 states, is 40th per capita for what they spend on public health. So we're already 40th, way down at the bottom. So that was something I did not know, nor did any of my counterparts.
Now we
So-
all know.
Yeah.
We all know. We didn't know. Thank you
So-
so much. Thank you. Eyes opened. Thank you.
Sorry, I'm taking notes. It's hard to take notes and run a meeting. Is there any other questions? Oh, Mrs. That's okay. Let me get you turned on, Kelly. Go ahead.
Okay, thank you very much.
I see you, Julie.
Member Mitchell's questions brought up some of my own, which is,
Okay, I'm sorry.
yeah. Sorry. I just feel like I have to ask since you're here and you're so knowledgeable. So, do you know the federal funds that are being withheld from our county health department? Do you know what's being done with those funds? Do you know where they're going instead?
I mean, I don't.
Okay, all right.
So-
I'm just curious. I was wondering if it was anything to improve public health overall. I'm hopeful, but I haven't.
I know there's a
heard
lot of reorganization from the stuff you read, there's a lot of reorganization at the
Sure.
federal level. So I'm assuming that it's just being reorganized into other departments. I'm not
Okay.
exactly sure.
I haven't seen anything that says that there are any federal programs that are going to be coming out to improve public health, but I will take a
Okay.
closer look. But, and by the same token, I haven't had my federal taxes go down at all either. So, with withdrawing, is it the withdrawal of these federal taxpayer dollars that are leaving the hole in the budget?
Was that a question?
Yeah.
Well, it all funnels down.
Right.
So if they reduce money for HIV, STI at the federal level, then, because most of our grants are federal pass-through. So it goes to the state and then the state allocates
Sure.
it out to us. So overall, I would have to say it is because, and it goes to private, we have also grants from private entities. Community-based organizations are also missing getting less funding. So then that increases the need at the bottom level. So I'm assuming that it's most of our pass-through money, correct?
Okay, and the state of Illinois isn't holding on to those funds that are passed through. that we would have typically gotten. They're not.
Well, they haven't told us about some of our grants yet, so we're still waiting
Mhm.
on like the city readiness and the HIV, which all started on July 1st. So we don't exactly know where it is in the chain as it's coming down. But I'm assuming they're trying to get it out to us as soon as possible.
So
But
those funds have been received by the state?
I don't even know.
Okay, all right, that's my question, because if
Yeah.
the state's holding on, then we really have a lot of other questions. But if it's just the capriciousness of some federal policies, then.
They haven't told us that.
Okay, thank you very much, I appreciate it.
Okay, Julie Berkowitz has another question.
Thank you. So, referring to Board Member Mitchell's, comments, which were excellent. Let's step back and we're Illinois. We are the fourth largest county in Illinois. I would imagine, pay some of the most taxes in Illinois to our state government. So what is our state government doing for us? What is Illinois? How many millions of dollars in grants do we get from the state of Illinois?
Straightly from the state and not through
From the
pass-through.
state, let's back away from federal. Let's focus on where we're at. We're state of Illinois.
And we could certainly get that information for you off the top of my head. I can't tell you what's general revenue fund as opposed to what is through the state.
So we're talking grants,
We're
federal
talking grants,
government grant,
absolutely.
this grant, that grant. What do we get in grants from the state of Illinois?
I mean, I know we have,
Just, yeah,
we have our local
send us
health
the
protection
information.
grant. We'll absolutely
Yes.
send you that
Okay.
information.
I'd like to know how many millions of dollars our state government is providing to the taxpayers and the residents in Will County.
Certainly.
One of the largest counties in the state. What are they doing to help us?
We can get.
And where do those dollars go?
And you're referring to just state money, not
State
money
of
that has,
Illinois.
not
Yeah.
money that has come from the federal first.
I
You're
am
just wanting state.
Exactly.
I think that's a good
Yes,
question.
and any grant, when we do get a grant, we have to submit a very detailed budget, so explaining everything. And if you make any changes in that budget, then you have to resubmit to them for approval. They have deliverables that we have to show. That's how the budget relates to the deliverables for the grant. So most of the time, you can't deviate from those, you can't deviate from those deliverables, and you have to use the money the way you submitted it to the grantor, or you have to revise it and they have to reprove it, or
And-
they will not accept it.
And
Grants
that's,
are very specific.
in layman's terms that people can understand, I want to understand, what does that grant require? Okay, we know our governor has made Illinois a sanctuary state. People are flocking here for these services because they know they can get them versus some other states. So we're seeing a rise. We see people, I've had several people tell me that the wait's longer, to get services at the health department because there's more and more people. This all has an impact. So let's look at what the state's doing. Let's look at, because they should be more accountable to us, especially.
So
if
you
we-
can get us that
We can get you our list
information?
of our
That would
state
be
grants.
great. And
that
again,
clearly
just if you
state,
could get it
yes.
to Chuck.
Of course.
Does that
With-
help you?
Yes, with those details and an explanation
Yeah.
of where
I
that money
think
is
some notes, some
spent.
checks over
Thank
here,
you.
strip on the way. Okay, are any more questions? Thank you, ladies.
Thank you. Have a nice fourth.
Next up is the report from Dr. Kathleen Burke on substance use and initiatives. Did you have any questions for Kathleen or Dr. Burke? Okay, all right. I just have to say, you're still doing awesome. I love the fact that those overdose deaths and reversals are going up and the deaths are coming down. I like that. Okay, so that completes our informational reports. We do have a public comment. So if you would like to come up, I would ask that you please state your name for us for our records. And if you sit right there where that red light is, that would be great.
Hi, my name's Tracy Henning. I've been a Will County resident since I was 4. Um, the reason that I'm here is I need some help. I live in unincorporated Peatone in a small town called Andres, Illinois. I live with my friend. He's in the back of the room. His name is Chris. We live next to a grain elevator, which used to be a very small, like farmers co-op grain elevator. And then a company took them over a few years back, like maybe 2014 maybe, or 2013. Thank you. I'm sorry.
Julie.
I'm just trying to get cut to the point here. The grain dust fallout, it was substantial, very substantial when the new company took over. They did come to the house. In fact, one of their employees literally walked in the front door with never even knocking. And they said if there was ever any issues or any concerns that we could just let them know and they would be more than willing to work it out. Well, the dust started falling every day. And when I say dust, I just want you to have a really, like a picture. A black car. You could not even tell that the car was colored black. The green foliage on the flower garden in the front of the house, there was no green foliage. It was all a mixture of white and pink, like the pink dust that comes off the corn. We did mention it to the gentleman next door, and they told us we had to deal with it. So a couple years had passed, and I started getting really sick. And I was first diagnosed. I was just all kinds of very unique symptoms. I ended up being diagnosed with toxic grain dust syndrome. Strangely, a few months before that, Chris has a dwarf horse. He's about this tall, and he too was diagnosed with toxic grain dust syndrome. We did talk to, again, the like the plant manager next door, and their comment seems to be always the same, that I just have to deal with it. Okay, so now this has gotten worse. We've contacted the EPA. We talked to the land use department, and I'm not mentioning, I'm not going into detail all of the other things that have been the consequences of the county allowing this to happen to us. And when I say how close we are, we're about 6 to 8 feet from this facility. They're literally 6 to 8 feet from the facility. Every time the dust falls, I now have been diagnosed with lupus. Since with all of this, every time the dust falls, it causes me serious, debilitating symptoms. I can't even get out of bed. Sometimes I can't get out of bed. Sometimes I need to be carried to go use the restroom. Sometimes I need to be carried to go and to take a bath. Now, when the dust doesn't fall, my symptoms start to recede. And how fast does this happen? If we have a good dust fallout at 2 o'clock, I absolutely have a fever that exceeds 101 degrees almost every day of my life. But when we get that fallout, it's about an hour, 2 hours, 2.5 hours that I get high grade fevers. You cannot control a high grade toxic dust grain syndrome fever with a Tylenol. It doesn't do anything. So I'm living every day of my life with fevers and lupus symptoms that are just exacerbated when we get the dust fallout. I don't know what to do. We've contacted who we thought maybe could help us in the county. No, I'm not coming here for pity. I just need for somebody to help me. I need answers on, or what can I do? I don't have the ability to leave the residence that I'm at. Yet every day I'm there and we get fallout. I'm sick, everyone. It makes me sick. Now, when the dust fallout isn't bad, or the wind's blowing the right way where we're not getting that dust fallout, my immune starts to recover, okay? But it's only a matter of days before the dust comes back our way. I've been on double the recommended government doses of hydroxychloroquine. I have been on chemotherapy pills to try to mask the consequences that I'm getting from the dust fallout. The chemo pills make me so sick. You know what? They're trying to counteract the symptoms that these are all happening from the dust fallout. The EPA has acknowledged that they are running beyond the legal means of the fallout. Yet nobody's still doing nothing.
No.
This has been going on for more than 4 or 5 years.
So I did speak with Tracy right before the meeting, and she did tell me that there is a lawsuit that the EPA or the Illinois Environmental Agency
They have,
has going on.
I believe they wrote them a letter of intent to sue.
Oh, so there's an intent to sue.
I believe. Listen, I can't even really deal with the legal, Chris is the homeowner. I can't really even, and I'm sorry, I can't even deal with the legal stuff with this because when this dust fallout that I have toxic, it heightens, it exacerbates my lupus extremely, which exacerbates, I have never had a problem with anxiety. I have so much anxiety just sitting here in front of you guys right now. I feel like I could just lay down on the floor, okay? I have to try to stay away from it because the more anxiety that I experience from the things next door, the sicker I become. And again, I've never had lupus. I don't know anybody who's ever had lupus. This is just the way it's affecting me. Okay. So I don't know how to make it, but the doctors, they don't know, they don't have any more resolutions for me except why are they being allowed to operate this way? And they don't even have an operating permit to run. Yet it's still happening. And you know what? It's just one little me. I'm a nobody, you guys. I'm not smart. I'm nobody. I'm just a resident of Will County. I had moved in with my friend a few years back from being displaced permanently. And it's like, how can this continue to go on? Why is this okay with everyone? Why is it
It's not okay with me, and I didn't know, and I appreciate you being here, and I appreciate you coming and having the strength to come and share this story with us. And I see by the head shaking, I'm not the only one on this committee. I have encouraged Tracy to go to land use as well after this for public, because I have a feeling it's going to get moved there. But it is something I want us all to look into. Usually we don't have a back and forth with public comment. But I do have a question. I know a couple of you have to go to land use next because you're on that committee as well. So, Julie,
Thank you, Micah. Ms. Fleming, Ms. Henning, I know it took a lot of effort for you and Chris to come here today, so I appreciate that, and I'm sorry for what you're dealing with, and you do matter. You're not a nobody. You're very important, and everyone here is very concerned, and your efforts today, we will move forward accordingly and see what we can do to assist you. I'm going to recommend, Micah, that Chuck navigate this and get all of the information. Chuck, I know because this is land use and it's not under your purview.
it's also health. I think it's part of health too.
Okay, but the whole issue with unincorporated land, it's going to fall to land use. So that committee is going to have to really kind of put their arms around this issue. If it is a land use issue, we have to determine that. So if you will provide Mr. Pelkey your address and all of the information he needs so we can proceed with this. It's a little complicated because, as Micah said, it is a public health issue, but if it is a land use issue, that will, the dynamics will be a little bit, expanded. So,
Thank you, Julie. I was
stay
gonna
here.
suggest that I want
Yeah.
her address. and
So,
contact
so
information,
please,
too.
stay here, and after the meeting, we'd like you to talk to Mr. Pelkey and give him that information that he needs, okay?
Okay.
But, I'll keep you in my prayers, and, thank you very much for being
Yes.
here today.
And thank you for hearing me. And I am sorry for being emotional through this.
Oh,
but the
No,
the
don't
outcome
apologize
is-
ever for
it's
that.
debilitating. It's
Thank-
debilitating.
Thank you.
Thank you.
I'm also going to suggest that Chuck get that information. I was going to say it, but before I move on, I would like for Chuck to be able to get that information to the health department because of the environmental aspects of it as well. I have no announcements, and I have no need for executive. Can I get oh, I need another call on public health. Any more public health comments? Public health, he said public health. He said public comment. I said public health. Sorry. Taking notes and running a meeting, it's a challenge. Last call for public comment. All right, we can move on. Motion to adjourn by Mitchell and seconded by Hickey. Thank you. Our next meeting is scheduled for August 7th. See you then.